Melissa. I'm here to discuss with you a topic about social phobias. How many of you have probably diagnosed yourself, I should say, or think you guys carry symptoms of social phobias? Social phobias. So let's discuss what social phobias are. I'm going to discuss what social phobias are, the symptoms, how to recognize them, and then how do you treat social phobias.
You're going the wrong way.
Okay, social phobias. According to those American Psychiatric Association of 2017, social phobias are often cultural. They affect people of all races and social classes. So social phobias, what they are, they can be seen as a medical condition, as a disorder, and it's just an individual who feel an overwhelming anxiety feeling. So a lot of us feel it as like students. It said that it occurs as early as 11 into like your mid-20s. So students, hardworking people, just anybody who actually just feels kind of in an area where they have social anxiety problems. Basically any area where you have interaction with somebody. So they feel anxiety, they feel like overwhelming kind of judgment from people. They feel like negative thoughts flowing into their head. And so some emotions you can see, it's mostly physical in someone's face. You can see someone being shy, quiet, backward, withdrawn, inhibited, unfriendly, nervous, aloof, and disinterested. So somebody that's not, trying to exhibit all their emotions, you can clearly see it sometimes within them or sometimes by their behavior. How to recognize social phobias. So some symptoms I looked up by, it's called MayoClinic.org. And it's the most updated page of April 2017. A doctor named Thomas A. Richards had explained that some symptoms you can see are anxiety, high levels of fear, nervousness, automatic negative emotional cycles, a racing heartbeat, blushing, excessive sweating, dry throat, mouth trembling, and muscle twitches. Thoughts of feelings and anxiety persist or chronic. So it's not happening all the time. You can see it sometimes when the person is calm, sometimes when they're not, mostly in a time or an area. For instance, like making a speech today, a lot of people probably felt anxiety right before that, a rushing kind of like blushing feeling in their face, and they kind of feel like a racing heartbeat, clammy, nervous. That's actually social anxiety there for you. It also differs from how severe it is. Some people have it very like moderate, and some people actually have it where they can't even control their behavior. And then how to treat social phobias. So according to help.org by Melinda Smith, updated 2017, I read a website that was actually the most informational that helped me out with my social anxiety. I recently went to a doctor to look up social anxiety, and it's actually very common. They actually take it very casual of a procedure. What they do is they give you a survey, and you can do 1 to 10 and just agree and strongly disagree to whatever of your likings of like, they give you different situations in your life, and then you can see if you agree or disagree if it applies to you or not. So it kind of gives you a better insight of where you're at with anxiety in your body. Not everybody has it. It's not a scary feeling, but if you do have it, you can learn how to recognize it and control it a lot better. So there's management options like, of course, breathing better. I read about one of those. You can just easily control your breathing, having fresh air, having a little bit of 10 minute to 30 minute exercise, or just of any active movement. Also, I read that it said that you don't have to go straight to medications or what's it called, cognitive behavioral therapy, which is an individual therapy where you can talk one-on-one with somebody, or you can go into a group and talk to somebody that has the same situation as you. They may be all different, but at least you can get some more insight on how to control something personal to you. Group therapies are really good. And after the completion of social anxiety specific CBT, which I mentioned, cognitive behavioral therapy, people with social anxiety disorders have changed. They now live a life that is no longer controlled by fear and anxiety. That's a broad statement that I read from help.org, but everyone's a little different. It takes them a little bit different timelines and see what adjusts to them. Most medications are like beta blockers, or something's gonna numb like your serotonin levels. That way that you need a serotonin inhibitor, so you can feel a little bit normal again. What it does, it just gives you more chemicals and neurotransmitters into your brain that helps you feel a little bit more balanced out, more mellowed out too as well. But I don't recommend medications to a lot of people personally. I'm actually going to go into CBT, which is like counseling. You can go into counseling with an individual. Complete stranger is probably the best way to talk to somebody, unless you know friends that have dealt with this or have not. You can seek to family and friends. I have not seen cases of life-threatening cases, but there is an area we can go into, like, you know, for depression control and to like suicidal thoughts too as well. But anxiety, a lot of us students have it amongst ourselves. And after I did a little bit of research, I actually looked into a documentary that came out in 2012 by Paul Gibbs. It's called Social Anxiety, Thinking Outside the Box. It's pretty much about some patients that he researched on controlling in their day-to-day life, about how they controlled like claustrophobia and other disorders too as well. And then last, I just discussed what social phobias are, how to recognize them through symptoms, and then how to treat it. Thank you.